Hi, Kevin Henry, the Group Editorial Director for Advanstar and Dental Products Report, and I'm on a Google Hangout today with my friend, Dr. Sheri Doniger. How are you, Sheri?
I'm doing great, Kevin. How you doing?
Doing really well, thanks. Hey, would you first of all tell our viewers a little bit about yourself and about your practice?
I have been a practicing dentist for 30 years, 31 years this year. Before I was a dentist, I was a hygienist. So I still do my own preventive services. I do all my prophies. I do all my scaling and replaning. I have a one-chair practice in Lincolnwood, Illinois, and I love it. Love working with my patients, and love doing everything I do.
Very cool. And you contributed to our March cover story for Dental Products Report on the unsung heroes of the dental practice. And your contribution was talking about the ProphyBrite air polisher from Bosworth. And I know that you're a big fan of that product. Could you just tell me a little bit about why you love it so much and what it's done for you in your practice?
Well, first of all, it is the best thing I have in my office. Truly, it's ergonomic, it's lightweight, it's portable, but more importantly, patients love it. It cleans teeth with a sodium bicarbonate powder. Flavored sodium bicarbonate powder very quickly. Patients enjoy getting out of the chair a lot quicker after their preventive visit, and you know how you love being in the chair for preventive visit. And there's so many things about it that are just incredible, and we've been using it for wow, many years already. And people come in and ask, wow, what flavor am I getting, and am I getting the air polisher today? So when people are asking about it, it's patients are loving it.
Is it something that you have to explain to your patients, or how do you kind of introduce that to them?
The first time I use it on patients, I tell them that it's an air spray. It's air, water, and sodium bicarbonate, but it doesn't really taste salty. It's a spray that we sort of power wash, power blast off all of the plaque, debris, materia alba from their teeth, and go around their mouth relatively quickly, paying attention to each particular tooth, and then we're finished. So after I explain it, I usually will try it out on one molar tooth just so they kind of get an idea of what it's like, and then we go for the rest of the mouth, and when we're done, we rinse out the water, and there's no grit like you'd have in a prophy polish, and no real residual flavor.
So, Sheri, correct me if I'm wrong, but you do your own hygiene in your practice, isn't that correct?
I absolutely do my own hygiene. I see every single patient, every hygiene patient. I do hygiene every day. So I'm up close and personal with every tooth that I see, because I'm paying attention to every surface when I'm especially doing the air polishing, because you have to pay attention to where the tip is. So and I think that's a big bonus, to be able to do your own hygiene, because you're paying very close attention, and you can talk to the patient if you see something immediately, especially after all the plaque is blasted off on the tooth with the air polisher.
And last question for you. I know you mentioned whenever we first started about the ergonomic aspect of this, and I know that's something very important to you and one of the reasons why you've been able to practice for so long. Just talk about the ergonomic nature of the ProphyBrite and how it helps you out.
Well, it's so lightweight, and the tip is so easily movable that I can get to every single area of the mouth very easily. And the other ergonomic part about it is that it's portable. I'm not dragging something from one side of the room to the other. It's already there on my tubing, and I am able to use it anytime I want to. The most important aspect of it, though, is the lightweight concept, that if I have a patient that has a partial and I want to clean all the plaque and materia alba off of that, I would just move it over to the sink and be able to easily clean every single corner of that partial with the air polisher, and then go back and deliver the partial back into the patient's mouth. And again, you can twist the point any way. It's easily moved. It's easily maneuvered.
Sounds great. Well, Sheri, thanks for your time, and thanks for letting me know about the great things about the ProphyBrite in your practice. I really do appreciate it.
Well, thank you for inviting me, Kevin. Have a wonderful day.
You too. I'll talk to you soon. Bye.
Thank you. Bye-bye.